Hey everyone, so today I wanted to walk you through this case here. So when this patient came in, one of their main concerns was that when they smiled, they didn't show very much of their teeth. And you can see here that you can see a good portion of the bottom teeth, but you don't see a lot of the top teeth when they smile. And why is that? So when we take a look, we can see that overall there's just mild misalignment of the top teeth and the bottom teeth. So really the teeth are fitting together okay in the back, but why is it that when they smile, you can't see those teeth? The reason actually has to do with where these teeth are positioned within the jaw itself. So you can see here that these teeth are positioned higher up within the jaw, and you can see that the upper lip rests in such a way that it doesn't show any of those teeth. And even when he smiles, he only shows a limited amount of those teeth. And so what can be done in a situation like this? Well, historically, the only way to correct something like this was to actually move the jaw itself in relationship to the rest of the face. So you would have to have jaw surgery, and they would actually cut the jaw and move the entire jaw downward, and then they would fixate that with plates. And that would be one way to move the teeth down so that you could show more of them when you smile. But jaw surgery does carry risks with it. It's fairly invasive, and so now we have other options. So what we did is we started with braces, and you can see that even with just braces and wires, the wires themselves can start to move those teeth down so that we're starting to see more of those front teeth when he smiles. But then to get even further smile show, we can add a TAD, or a temporary Anchorage device. And what that does is it provides an anchor for this spring here to push on this wire and move all of these teeth down as a unit. Now, one of the questions we get is, well, if you move the teeth down, isn't it going to just pull them right out of the bone? And the answer is no. So as these teeth move downward, the teeth via the roots of the teeth actually pull the bone and gums with it. And so the net result is that it's pulling the teeth within the jaw and it's creating new bone on the way down. And so it basically lengthens the front part of the top jaw, which results in you being able to show more of your teeth when you smile. So this is 3 months after the TAD was placed as we're continuing to bring those teeth down. And when we go to the final superimposition, what this shows is where the teeth and the jaws were at the beginning of the treatment and where the teeth and jaws were at the end of the treatment. And you can see here that as these teeth moved all the way down here so that he could show them in his smile, all of the new bone and gums fills in underneath in this area here. And so when we look at the final result, this was only 14 months total. You can see his teeth are fitting together well, but most importantly, you can see that he's actually showing more of his front teeth. If you have any questions or comments or want to learn anything else or discuss anything else, go ahead and drop them in the comments. Be sure to like and subscribe and follow us for more. Thanks so much.